The federal government has renewed its commitment to ending neglected tropical diseases in Nigeria, describing the illnesses as conditions driven by inequality, weak health systems, and limited political attention, despite being largely preventable and treatable. The Minister of State for Health and Social Welfare, Dr. Isiaq Salako, stated this in Abuja during the commemoration of the 2026 World Neglected Tropical Diseases Day. Represented by the Permanent Secretary of the Ministry, Daju Kacholo, the minister noted that NTDs disproportionately affect women and children and cut across both communicable and non-communicable disease categories.
Today, we gather not only to raise awareness, but also to renew our collective commitment to ending the scourge of NTDs in Nigeria and across the globe. Neglected tropical diseases, as we all know, fall into the categories of communicable and non-communicable diseases, mostly prevalent in children and women, and largely associated with poverty, poor sanitation, unsafe water supply, and substandard housing conditions. Globally, over 1 billion, which amounts to about 12.5% of people, are affected with NTDs across 149 countries, with Africa bearing about half of the global burden and Nigeria accounting for about 25% of the cases on the continent. Nigeria has more than 200 people at the risk of one NTD or the other, and 165 people needing preventive chemotherapy for at least one NTD.
Also speaking, the Director of Neglected Tropical Diseases at the Federal Ministry of Health, Dr. Fatai Oyediran, called for increased domestic funding and the integration of NTD programs into universal health coverage, noting that improved budgetary allocation would expand coverage nationwide.
LGAs that have been catered for are negligible, and that is attributed to the paucity of funds and the support that we are getting presently. But all the same, we are trying to scale up the coverage, and we have also tried to input that into the federal government annual budgetary provision, the funding support that we are getting from the partners in that regard. So there's no doubt about the fact that we scale it up as much as funds are available within our reach to enlarge the scope that we have achieved now.
World Neglected Tropical Diseases Day 2026, observed on January 30th under the theme Unite, Act, Eliminate, seeks to mobilize global action against diseases affecting over 1 billion people as Nigeria aligns with international efforts to strengthen political will and secure funding toward meeting the 2030 elimination targets.